Okay, what I'd like to demonstrate in this video is the application of a bleach to a bleaching tray. This bleaching tray that we have here is made at the dentist. It's not one that you can buy in the store. It's custom made at your dentist. Here in my office, these are the kind that we make. We do not do the 1 hour in-house bleaching. We prefer to do the ones where the patients take it home and do the bleaching on their own. Tends to be a little bit more long-term, and we have found far more successful and less expensive. Anyway, this is the mouthpiece right here, and we have the bleach, which comes in a little syringe like this. And what you really want to avoid doing when you put the bleach in is just to put it directly in at the bottom. The reason being is that when you finally put it in the mouth, that half that bleach is going to run up the back and only half is going to run up the front of your teeth, therefore not covering up the entire area. So really what you want to do, if I can get this focused in a little closer, is if you look very close at your mouth guard, you will see the little arches of where the gum and the tooth come together. What you would like to do would be to put a little bit of bleach right underneath those arches. That way when you slide the mouthpiece up, the bleach will slide right along the front of your teeth, and very little, if any, will come through the back. Also, you don't want to put it too high, because then it's going to run over the front of this and you'll end up having most of it in your mouth. Again, this is not harmful. We don't recommend that you eat it or drink it on a regular basis, but if you do swallow a little bit, it is okay. Okay, so again, what you want to do is, most of these are very concentrated. The ones we use in my office are 22%. You can get anything from 10, probably up to 30%, although the 30% does tend to create some sensitivity, which I'll touch on in just a second. Okay, so what you want to do again is put a little bit of bleach right on the arch here. Put a little bit right there, and a little bit right there, and again just come here. Now if you want to run it all together, that's fine. I just tend to put a little bit below the arch of each tooth. When you finish on some syringes, you really need to pull back, suck back on that so that the bleach won't run out. Now I only did it really on this one side. You might be able to see the bleach through the mouthpiece right there. And again, it's just on the inside. And then go ahead and insert it in the mouth. And once you have inserted it, I tell my patients to just press along the front here, just to make sure that bleach kind of spreads out a little bit. The recommendation is for at least an hour a day. You can wear it really as long as you would like. The bleach is probably active for maybe a couple hours or so. Many patients will actually sleep with it. If you can, you put the bleach in and pop, after you've cleaned your mouth of course, pop the bleach in and put it in and then go to bed, and it's okay. You will find that the bleach will dissipate by the time that you awaken in the morning. If you choose just to do an hour or so while you're reading or watching TV, when you take the mouthpiece out, there will still be a little bit of bleach left. You can go ahead and wash it off with just plain water, and probably recommend that you don't eat or drink anything for at least 30 minutes or so after you've removed the bleach. Let that kind of soak in. What you do not want to do, however, is you don't want to do several applications during the day, because what will happen is the teeth will tend to become sensitive to cold. I also recommend to my patients a desensitizing toothpaste during the treatment time. You can use Sensodyne or Crest or Colgate or anything that deals with sensitive teeth. So I think that pretty well demonstrates how to put the bleach in. Again, just a quick review. Make sure that you find the little arches and you're going to put a little bleach, as we're demonstrating here, just underneath that arch. Again, you don't need much, it's very concentrated. Probably you don't want to go all the way back. There's really no reason to bleach these back teeth unless you have a smile that absolutely shows it. Otherwise it's just going to run out the back. So again, try to keep it confined to, say, the front 6 to 8 teeth. This is an upper mouth guard. You may have a situation where you have both upper and bottom, and again the procedure would be the same. You hold the mouth guard with your thumb and your forefinger, and it's probably best to do it like that, and then syringe in as demonstrated here. And again, don't forget to pull back on that syringe so that the bleach won't keep running out. Best to keep the bleach in a cool area, not necessarily the refrigerator, but just in your medicine cabinet. What you do want to avoid is any extreme heat. If this does turn to a liquidy state, it will not be as effective, and of course it'll run all over the place. You want to keep it in a gel state. Okay, so that pretty well demonstrates the way to apply bleach to your bleaching guard.